Hello. My name is Jones, and today we are going to look at how you can choose your nursing care diagnosis. Okay, apart from this, we are also going to look at how to come up with a nursing intervention. Okay, so as you are nursing a patient, how do you come up with the interventions? Okay, so now, once you have analyzed your assessment data and selected the most obvious nursing diagnosis for your patient's nursing care plan, you should review each area of possible need to ensure that you have not missed an important area. One way to conduct this review is to keep in mind the acronym RN is HOPE. Okay, so we are looking RNs, like registered nurses HOPE. Okay, so this one I've just tried to coin it and trying to simplify how you can choose your nursing care diagnosis, because a lot of people in their training and sometimes in practice they have problems in coming up with the nursing diagnosis. Okay, so when you're looking at the RN's HOPE here, it covers a lot of areas of basic needs. So the letter R is for rest and activity, N is for nutrition, S is for safety, H is for hygiene, and P for psychosocial. Okay, so that is to do with the psychosocial needs and the likes. Then E is for elimination and education. Okay, so in the RN's HOPE, here you can have a lot of nursing diagnosis phrases that you can make, okay, based on the same. Let me try to give some examples under the rest and activity, which is the R part. So examples of nursing diagnosis that are grouped under the rest and activity may be activity intolerance. So when you're looking at activity, rest and activity, here, activity intolerance becomes one of those nursing diagnoses. Okay, so with this, please, I would also want to mention that I've done a lot of presentations on how to come up with a nursing diagnosis and other things that you need to add. So here, this is just a phrase or part of the nursing diagnosis without the other components that are there. So these are like nursing problems that we are discussing. And for it to form a diagnosis, you need to add issues of related to, evidenced by, and the like. So here we are just coining the problems that can be there before you put the evidence and the related to part. So under rest and activity, we have impaired physical mobility. We have problems like fatigue. We have problems of like sleep deprivation, which you can write due to or related to, and then pain, which may be acute or chronic, also affect rest and activity. Okay, if patient has got a fracture, you just know that rest and activity is affected. Okay, even a patient who is depressed, you know that rest and activity, those are affected. So this is how you can come up with the nursing problems in building up to your nursing diagnosis. Okay, so I've made emphasis that when you are now writing a nursing diagnosis, you need to write evidenced by or related to. So these that we are coming up with, these are the problems. Okay, so this is the root part of your nursing diagnosis, which is the problem. Okay, so now this takes us to the other part of our RN, which is in nutrition. Okay, so nutrition is part of how you coin up nursing diagnosis. Okay, so the problems that are under nutrition include risk of impaired liver function, imbalanced nutrition, less than body requirement, self-care deficit due to problems of feeding, okay, risk for constipation, okay, risk of unstable blood glucose level, impaired swallowing, or fluid volume deficit. Okay, so when you talk of risk, when you're talking of nursing problems, you know, they are what we call potential and actual. So when something is put as a risk, then you know that this is just a potential problem and not necessarily an actual problem. So when you talk of risk, mostly you don't, or you should not put evidence by, because it is a risk, so those things might not be there, might not be present. Okay, if they are now present, then it means the actual problem is there. Okay, so to do with the nutrition, other problems that you need to note can be nausea, okay, or risk of electrolyte imbalance. So all these fall under the problem of nutrition when you are coming up with a nursing diagnosis. Okay, so now we move to S in the RN's hope, and S, okay, it encompasses problems to do with acute confusion, contamination, risk for contamination, readiness for enhanced comfort, risk of injury, impaired physical mobility, risk for infection, impaired skin integrity, risk for impaired skin integrity, risk for peripheral neurovascular dysfunction, impaired verbal communication, hypothermia, risk for falls, impaired memory, and wandering. Okay, so all these form the root problem of your nursing diagnosis and safety. Okay, in the RN's hope, the next letter that we are looking at is H. So some of the root problems that may form your diagnosis under hygiene include readiness for enhanced self-care, self-care deficit. Okay, so self-care deficit may be in relation to toileting needs that the patient may need. Okay, and then a self-care deficit can also be to do with dressing, and a self-care deficit can also be to do with oral care or bathing. And hygiene, also we have impaired oral mucous membrane, okay, that may come as a problem of hygiene, as the patient may have what we call foul breath or halitosis. Okay, so in the other hands, hope we have dealt with H, and then now we move on to O, which is oxygenation. So there are problems that may come to do with oxygenation, okay, that form the root of your nursing diagnosis. So some of the problems may include ineffective airway clearance, risk for aspiration, risk for decreased cardiac tissue perfusion, or ineffective breathing pattern. And then you can also have impaired gas exchange, or ineffective peripheral tissue perfusion, or decreased cardiac output. So these are some of the problems that may come under oxygenation, forming the root of your nursing diagnosis. So in the RN's hope, we have dealt with E, H, and O. Now we are dealing with P, which is for psychosocial needs. So under the psychosocial needs, we have ineffective coping. Okay, we also have readiness for enhanced decision making. Then we have a risk for compromised human dignity. Then we can have interrupted family process. We can have a problem of fear, anxiety. We can also have a problem of disturbed body image. We have also other problems that include ineffective health maintenance, impaired home maintenance, readiness for enhanced hope, or you can also have problems to do with the moral distress. We can have problems to do with the readiness for enhanced power, or chronic low self-esteem, or patient may have under psychosocial as a problem of spiritual distress, or may also have a problem under the psychosocial, which is social isolation or stress overload. So these are some of the root problem forming your nursing diagnosis under the psychosocial area. All right, so in the RN's hope we have dealt with P, and then now we're dealing with the last part, which is elimination and education. So the root that will form your nursing diagnosis under elimination and education may include areas like constipation, urine retention, urinary incontinence. Okay, then may also have problems to do with urinary incontinence that may be because of issues of stress, or under elimination there can be a problem of diarrhea, or we can have problems of bowel incontinence. Other problems may include self-care deficit because of poor toileting needs that the patient may have because of the disease. Okay, so under elimination, also the problem of fluid volume excess or deficit may come in because of issues of diarrhea. And then under education, that is elimination and education, is the issue of sexual dysfunction may come, and also the problem of deficient knowledge, which is very specific to education. So in trying to remember the root that form your nursing diagnosis, it is important to use the RN's WOP. Okay, the RN's WOP, registered nurses WOP, here where we have talked about when you are coming up with a nursing diagnosis, look at these roots of the nursing problems that has to do with rest and activity, that has to do with nutrition, that has to do with safety, hygiene, oxygenation, psychosocial, and elimination, also education included. Okay, so with what we have just discussed so far, it's important to remember that many nursing actions are used to prevent problems, and in this event, these actions are grouped as the risk for or nursing diagnosis. So the three most areas that students most overlook are self-care deficit, deficient knowledge, and the major reason is that the patient is in the hospital, such as a patient having fractured hip, so that patient is going to have impaired physical mobility, or may have myocardial infection, and such a patient may have decreased cardiac output. Okay, so in addition, each medication to be administered and each procedure to be performed should fit under the nursing diagnosis, okay, and the plan of intervention are put in place. Okay, so now with this discussed, let us now try to understand how to come up with nursing intervention in our nursing practice. So intervention form the largest part of your nursing care as you write, whether it is a nursing care plan or as you are doing your general nursing care. So it forms the backbone of nursing, and the team nursing intervention tries to describe any action that the nurse may take to improve the health and the comfort of their patient. For those are considering advancing like in the field of nursing, intervention are really a crucial aspect in advanced nursing, like when you're doing your master's in nursing or when you're doing your doctorate in nursing. So intervention formed that crucial concept. So when you say a nursing intervention, according to the Journal of Nursing Education, nursing intervention can be described as one of the two ideas. Okay, so the first idea is any task that a nurse does to or for a patient, and then the other idea is that anything a nurse does that leads directly to patient's outcome. So these tasks may be general or specific and direct or indirect. Examples of areas of patient care intervention include sleep pattern control, mobility therapy, compliance with a diet, infection control, alcohol abuse control, positioning therapy. Okay, it can be bed-bound care or energy conservation and postpartum care. So in addition, a patient-focused care should also take in consideration the actual or potential deficiencies that the disease may pose to the body or system. Okay, so namely, we have the integumentary system, skeletal system, muscular system, nervous system, endocrine system, cardiovascular, lymphatic system, respiratory, digestive, urinary, and reproductive system. So when you're coming up with your nursing diagnosis and nursing problem, bear in mind how these systems have been affected. Okay, so you know that all these systems need to work very well for a patient to have balanced health. So apart from this system being affected, an individual does not exist in a vacuum. He has a certain dimension to balance well-being. So research has shown that a balance among the 7 dimensions of well-being leads to fuller, more satisfying life. So the 7 dimensions include the dimension of physical, intellectual, environmental, vocational, social, emotional, and the spiritual health. So in as much as you would want to look at how the systems have been affected, okay, it is also important to look at how these dimensions are affected when you're coming up with your nursing diagnosis and your nursing tasks. Lastly, also here I would want to say that during the illness there may be potential or actual deficiencies within the 12 activities of daily living that were proposed by Roper Rogan and TN model of activities of daily living. So this entails that apart from the systems of our bodies are being affected, we should look at the dimensions that I mentioned that can be affected by health in coming up with our nursing diagnosis. If not, then we also need to look at how activities of daily living have been affected. So the activities of daily living include maintaining safe environment, communication, breathing, eating, drinking, elimination, personal cleansing, okay, mobilizing, waking, playing, expressing sexuality, and also issues of sleeping and dying. So we need to critically look at how these have been affected. However, nurses may work in specialized settings like ICU, that is intensive care unit, oncology, pediatric, which may require knowledge of specific intervention that may be unnecessary in other areas. Although every nurse may not be familiar with every intervention, the concept remains universal across the field that you need to look at all these. Okay, so when you're writing your nursing care, there's some provisions that you can always look at in the NANDA, where he has tried to propose some of the interventions that problems that you can identify. So NANDA came up with a lot of nursing problems that you can look at when you're coming up with nursing diagnosis. Okay, but in trying to simplify all the dimensions that sometimes, okay, maybe even NANDA has mentioned, I've tried within this discussion in talking about RN's hope, okay, because it is not necessarily feasible that even if we were to talk of all interventions, and one nurse is going to master all the interventions, because certain interventions may be necessary according to the patient's condition. So here in my discussion, my emphasis is just necessarily on the the simplified RN's hope in coming up with your nursing diagnosis, or in coming up with the root problem as you write your nursing diagnosis. So thank you very much. We have really looked at how to come up with your nursing diagnosis, and also we tackled the issue of nursing intervention. Okay, so please, I would encourage you to also listen to other lessons that I've also recorded on how to come up with a nursing care plan. Okay, and also look out for some of the books that I've written, some yet to be published. So I've included this information because I feel it's essential, cardinal, and a simplified way of helping practitioners and those that are still training on how their work can be simplified as they are working to come up with a nursing diagnosis, and how to come up with a nursing intervention as they are helping out our patients out there. So thank you very much, and please keep studying.